Low back pain and neck pain are very common problems, and they are a major contributor to years lived with disability throughout the world. Now, as people age, the incidence or the likelihood for them to have back pain increases. In the CDC reports that about 28% of those between the ages of 18 and 29 can have back pain, 35% for those people between 30 and 44, about 44% for those between the ages of 45 and 64, and 45% in those people above 65 years of age. So very common to suffer from back pain and gets more as we age. Additionally, back pain affects workers, and some studies report that 10% of workers either have to stop working, change their job, leave their job because of low back pain. In this video, I'm going to talk about the controversial use of opioids to address back pain, but I offer a better alternative, which is exercise to help those patients suffering from back and neck pain. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. In a 2019 study, they found that as many as 2/3 of people in that group had been given an opioid as a first-line treatment for chronic low back pain or neck pain. Now, there are risks to using opioids, such as overdose, dependency, misuse, and even there are some increased risks for death. In 2020, an average of 44 people died each day from overdoses involving prescription opioids, which was totaling more than 16,000 deaths. Now, between 2019 and 2020, there was a 16% increase in prescription opioid-involved deaths. Other statistics between 1999 and 2020 had reported over 260,000 people who died in the United States from overdoses involving prescription opioids. This clearly is a widespread problem. In 2017, there was almost 58 opioid prescriptions were written for every 100 Americans. And more than 17% of Americans had at least one opioid prescription filled, with an average of 3.4 opioid prescriptions dispensed per patient. Do opioids even work? Do they help patients who have neck and back pain? And to answer this question, I'm going to review a recent article that was just published within the past couple of months. So in this study, researchers randomized 310 patients with 12 weeks or less of low back pain or neck pain or both. And they were either going to receive oxycodone, which is an opioid, or a placebo. And additionally, every patient received reassurance that they should likely get better, advice to stay active, and to avoid bed rest, and if required, anti-inflammatory medications. And here's what they found. There was no significant difference in pain at 6 weeks or 12 weeks between the groups. There was no significant difference in physical functioning. There was no significant difference for quality of life. And there was no significant difference between groups for the amount of time it took to recover, how much time they missed from work, or healthcare utilization. Now, conversely, interestingly, they found a small but significant difference favoring the placebo group for mental health at 6 and 12 weeks. Now, this study's final recommendation states, opioids should not be recommended for acute, nonspecific low back pain or neck pain, given that we found no significant difference in pain severity compared with placebo. Low back pain generally has a good prognosis. Most patients over the course of about 6 weeks will improve. However, a significant group of people, sometimes reported up to 2/3, can still have some discomfort or pain for as long as 12 months. Now, exercise has been shown in many studies to improve pain, function, and disability. For example, there was a meta-analysis of 46 randomized controlled trials with over 8,000 patients. And they found that the most effective treatment was exercise, particularly in the immediate situation within the first week of pain. They also found that manual therapy and physical therapy were also very helpful at 1 month and at 3 to 6 months, in addition to just doing exercise. Now, additionally, this study also found that those people who were taking opioids were the most likely to have an adverse event, where they reported up to 65% of patients who were taking opioids had some problem. Now, there was another study that looked at what types of exercise can help people who have chronic low back pain. Those are people who have had pain for more than 12 weeks. And this study, as I'll review, showed that there are many types of exercise that can be helpful. This was a meta-analysis with over 5,000 patients. And for pain relief, they found that Pilates, aerobic exercise, resistance training, and stabilization motor control training all were able to lower pain. Now, for physical function, they found that the stabilization motor control exercise, which is basically exercise training targeting specific trunk muscles in order to improve control and coordination of the spine and pelvis, as well as resistance exercises, were the best exercises to improve physical function. And with regard to improving mental health in these patients who have low back pain, they found that resistance exercise and aerobic exercises had the highest probability of being the best intervention for mental health. Let's wrap up this video and go over a few key points. Number one, non-pharmacological interventions should be the first-line treatment for people who have low back pain. Number two, opioids like oxycodone do not seem to offer any additional benefits over a placebo in patients with low back pain. And number three, for new onset or chronic back pain, exercise has been shown repeatedly to be very effective at reducing pain and improving function. Thank you for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.